Hello, everyone. I am Mary Velasquez, one of the many Sutter System Stroke Program coordinators. I am your moderator today, based out of Memorial Medical Center, Modesto, California. Today is October 29th, World Stroke Day. So we wanted to celebrate this day and bring awareness to the signs and symptoms and treatments of stroke. We at Sutter welcome and thank you for joining us at Sutter House virtual seminar, Stroke Causes, Symptoms, and Treatment. We understand that when you or a loved one are experiencing a stroke, you need experienced medical professionals as quickly as possible. In the Sutter Health Network, we provide expert emergency stroke care and comprehensive neurovascular care and rehabilitation services across Northern California. Sutter Health has one of the largest hospital networks with advanced stroke certification distinction in Northern California. We have some special guests today. I'm very excited about the speakers who will be presenting today. We will get started with Dr. Manoj Mittal, who will speak to stroke causes, symptoms, and treatment. He is a stroke neurologist and neurointensivist. He's the director of stroke and neurocritical care at Sutter Medical Center in Sacramento. He's actively involved in clinical stroke research and has published more than 40 papers in peer-reviewed national and international medical journals. Dr. Mittal, I turn it over to you.
Good morning, everyone. Let's talk about stroke today on World Stroke Day. As you all know, stroke is a medical emergency that affects around 800,000 people every year in US. It is the leading cause of disability and the fifth cause of death in US. Stroke is seen more commonly in the rural and southern areas of the country. Stroke causes a huge economic burden of about $36 billion per year. There are two main types of stroke: hemorrhagic stroke and ischemic stroke. Hemorrhagic stroke is less common than ischemic strokes. Hemorrhagic strokes happen due to a ruptured blood vessel, which causes bleeding in the brain. If the bleeding area is in the brain itself, it's called ICH or intracerebral hemorrhage. If the bleeding area is outside the brain surface from a ruptured aneurysm, then it is called subarachnoid hemorrhage or SAH. Ischemic strokes happen due to blockage in an artery supplying blood to the brain. Ischemic strokes are of 4 different types, depending on the underlying cause. If the underlying cause is hypertension, causing blockage of the small vessels, then it is called the Lechner stroke. If the underlying cause is smoking, hypertension, high cholesterol, diabetes, obesity, and lack of physical activity, then it may cause plaque buildup in the blood vessels, which over time may lead to clot formation on the plaque, leading to a stroke. If the underlying cause is a cardiac disease like atrial fibrillation, then it can lead to a small clot formation in the heart, which may move all the way to the brain, causing stroke. If the underlying cause is unknown, then we call it a cryptogenic stroke. So I often get asked, what is a mini stroke or TIA? So mini stroke or TIA looks similar to a stroke. However, the symptoms last less than 10 minutes. TIA is a warning sign of a coming storm, as about 10 to 30% patients may have a stroke or may die from a stroke over the next 3 months. So what does a stroke looks like? You are experiencing a stroke if you have acute loss of body function that happens over seconds or minutes. Stroke may continue to get worse over hours, but not over days or weeks. Stroke symptoms may affect either side of the body, right or left, and may include loss of sensation, motor strength, balance, vision, or speech. Stroke diagnosis could be very challenging in certain conditions like seizure, low blood glucose, dementia, anxiety, or stress. These conditions can cause symptoms that may look similar to a stroke. Unfortunately, people with these conditions can also have real strokes. A neurologist in the emergency room can help to differentiate a stroke from these mimics. An easy way to remember stroke symptoms is the mnemonic BFAST. B stands for balance. Stroke patient may have sudden loss of balance, difficulty sitting or walking, or they may have a spinning sensation. E stands for eyes. Stroke patients may have sudden loss of vision, may have blurred vision or double vision. F stands for face. Stroke may cause sudden facial droop or uneven smile. A stands for arms. Patients may have sudden loss of partial or complete loss of function in the arm or leg. S stands for speech. Stroke may cause loss of speech or loss of clarity of words. And T is for time. Time is critical. Friends, do not ignore your symptoms and call 911 immediately for help. Because time is brain, every minute delay in care is causing loss of 2 million brain cells. Every additional minute we can save, it can lead to 1 additional day of normal life in a stroke patient's life. How can we help once the patient arrives to the hospital? When a blood vessel is blocked, as shown here in the picture, then part of the brain it is feeding stops functioning. The central part dies first, and the peripheral part is able to survive for a variable amount of time, anywhere from 1 to 24 hours, due to a complex network of vessels in the brain. The peripheral part is called penumbra or salvageable brain tissue. This is the brain tissue at risk if you do not seek medical care. The sooner we can treat a stroke patient, the better the chance of their stroke recovery. Modern technology has enabled us to able to identify tissue at risk using CT scan and artificial intelligence. We use it routinely for our stroke patients. Here is an example of a CT perfusion scan of the brain showing a large amount of brain tissue at risk. The pink purple color over here shows already damaged brain tissue, and the green color shows the tissue at risk. If this patient seeks medical care in time, then the final stroke may be very small. However, if they are unable to get to the stroke therapy in time, they will end up with a large stroke causing permanent disability and possible death. Once we know that we have brain tissue at risk, we have 2 different treatment options. Treatment for stroke is similar to opening a clogged drain that you may have experienced. The first treatment that we have is like Drano for a clogged drain, where we inject an IV medication, which is a clot busting medication called TPA. It breaks down the clot and increases the chance of stroke recovery. This medication was originally used for heart attack and has been approved for stroke since 1996. This medication can be used for up to 9 hours, but sooner is better. The second option is similar to a snake for clog removal, where we mechanically remove the clot from the blocked blood vessel using minimally invasive surgery. There are several devices available for removing the clot. The most common device that we use is called a stent retriever. This device was approved in 2012 for strokes. It can remove blood clot effectively in more than 80% patients. This process is very fast and can be offered to patients up to 24 hours from stroke onset. This device has caused a revolution in acute stroke management. We have seen patients going home the next day after a large stroke. Over here, this cartoon is showing how we navigate a device from the groin area to the affected part of the brain. This is a wire. We push the device over the wire up to the blocked blood vessel. So the red part is the clot. We open the stent and we pull the stent out along with the clot and the catheter out of the body along with the clot. Let's talk about a patient story. A 60-year-old Irish gentleman went to bed at 10:30 p.m. He presented to the hospital at 3:40 a.m. with left-sided weakness. Imaging showed a large amount of brain at risk, like we showed you earlier. This is a picture from the cerebral angiogram. You can see this blood vessel is blocked over here. The arrow in the center is showing the blocked blood vessel, and the stent retriever is in position. The clot is integrated into the stent retriever, and we remove the whole device along with the clot outside. And the end result is this. You see the whole blood vessel is now open. And here is the clot along with the device. So this patient, after the procedure, went to the ICU and underwent complete recovery. He went home the next day. So this is the best case scenario that can happen. Another example, the 60-year-old gentleman, heavy smoker, goes to bed around 10 p.m. He woke up at 8 a.m. with right-sided weakness. He called 911 and arrived at his local emergency room. His local hospital does not provide this clot retrieval therapy. So he's sent to an advanced care center, which is 4 hours away. So you can see there's a huge amount of delay already that happened. He is not a candidate for IV TPA now because he's outside that 9-hour window by this time. But luckily, his brain imaging shows a large salvageable brain tissue. So he underwent clot extraction and made complete recovery despite long time to treatment. Here is an example about what not to do. So a 60-year-old gentleman, again, develops mild weakness on the left side around 10 p.m. His wife notices it and she says, let's call 911. He refuses and he goes to sleep. That's a mistake because he wakes up at 7 a.m. now, and now his left side is completely weak and he cannot move it at all. They call 911, he goes to the emergency room now. The brain imaging shows no salvageable tissue. Unfortunately, he's not a candidate for any therapy and he's permanently disabled at this point because of the delay in care. So how does COVID impact stroke? During this pandemic, people are scared and they're not calling 911 when experiencing stroke symptoms. As we discussed, lack or delay in therapy can lead to poor functional outcomes. COVID itself can cause stroke, even in young patients. These patients may not have classic COVID symptoms like cough, fever, or shortness of breath, and they may be completely healthy before the COVID symptoms. So people ask us, is it safe to go to the hospital during this pandemic? It is very safe because all the staff members in the hospital and all the patients that come to our hospital are screened for infection. And we take all precautions necessary to ensure everyone's safety. And the stroke treatment works for COVID patients just like it does for non-COVID strokes. So friends, remember, be fast to recognize a stroke. Remember this cartoon, remember the balance, eyes, face, arms, and speech, and call 911 immediately, do not delay. So what should you do if you're having symptoms? If your symptoms are minor or if your symptoms are lasting less than 10 minutes, you can call your primary care doctor and discuss with them. But you should be evaluated with imaging and other things within 24 hours. If for some reason that cannot be done, then it's best to call 911. When you come to the hospital, please bring a family member or friend if possible, and if allowed by the hospital, because it provides us information about your stroke symptoms, when it started, what medications you're on. All those are critical when we're designing your therapy for you. Sutter Stroke Program provide cutting-edge acute stroke care to millions of people in Northern California through its integrated network of hospitals and resources for acute stroke care. Stroke path to recovery starts with that 911 phone call and continues in a hospital, then to a rehab center, and then at home. People may recover, and the time taken for recovery could be 3 months and can sometimes be extended up to 1 to 2 years. So the bottom line is, acute strokes can be treated effectively if we recognize them in time by BFAST. Time is of essence. Don't lose it. We can remove the blood clots via IV TPA or the stent retrievers. We have experienced doctors using advanced technology who can help you achieve the best possible outcomes. I will give it back to Mary for our next presentation. Thank you, everyone.
Dr. Middle, thank you very much for that great presentation. Now we have Eric Pankoska, one of our RN stroke coordinators, who will speak to stroke lifestyle prevention. Eric, I turn it over to you.
Thanks, Mary, and thanks, Dr. Middle, for talking to us about acute stroke. As I said, my name is Eric Pankoska, and I'm one of the stroke coordinators. I work over at Mills Peninsula Medical Center over in Burlingame, which is one of Sutter Health's many stroke centers across Northern California. Stroke prevention is something that we in the stroke world find to be very important. We know how disabling strokes can be, and the benefits in educating every patient on their risk factors and on risk reduction practices. And today I'm going to talk to you, talk to everybody about different stroke prevention techniques and how you can decrease your risk for having a stroke. So let's first start by talking about the 4 big treatable risk factors for stroke. We define a treatable risk factor as a risk factor that can be modified through either medication or lifestyle changes. These 4 treatable risk factors are high blood pressure, diabetes, smoking, and heavy alcohol consumption. Each of these treatable risk factors increase a person's chance of having a stroke. And if a person has multiple of these risk factors that go untreated, that will greatly increase their risk for having a stroke and potentially a very debilitating one. Some other risk factors include age, sex, race, and genetics. Beyond those 4 big risk factors, let's also look at the prevalent medical conditions that we know are seen in stroke patients. This specific study looked at about 731,000 patients and what chronic medical conditions they had. Of these people who had strokes, over half of them had hypertension and about 20% of them had elevated cholesterol. The other risk factors that were listed included smoking, atrial fibrillation or AFib, and heavy alcohol use. That being said, the identification and management of disease conditions can greatly decrease someone's risk for stroke. And as you can see, about 90% of these conditions are preventable. And so reducing these risks could get that number down substantially. So that we looked at both the big 4 treatable risk factors and some of the common medical conditions. Let's talk about what we can do about those. Okay. So let's first look at medications. For individuals taking aspirin or high blood pressure, for individuals taking aspirin or a more powerful blood thinner, aspirin and, excuse me, one more time here, guys. For individuals who are taking aspirin or powerful blood thinner, these specific medications can help at reducing one's risk by decreasing the blood vessels' ability to become damaged or blocked. We also know from the previous slides that uncontrolled hypertension is a huge risk factor for those who have stroke. For individuals whose blood pressures are high, keeping it within a safe range is very important, and this can be done through a wide variety of antihypertensive medications. As we also saw from the previous slide, elevated cholesterol puts individuals at risk for stroke. And for these patients, your doctor may recommend you being on a statin to help reduce your total cholesterol. It is important to talk to your healthcare provider about the many different ways that you can help manage or bring down these chronic conditions and help improve your cardiovascular and neurovascular health. Besides these pills, there are a couple different stroke prevention methods that are out there that have actually been proven to be ineffective, and I do want to touch base on those. First, let's talk about hormone therapy. Looking at the data, we know that hormone therapy is actually not effective in preventing stroke at all. and it can potentially be harmful. For those of you, any of the individuals who are on this presentation or are listening, if they are currently on any hormone replacement therapy, don't stop taking it without discussing it first with your doctor if you're concerned about reducing your stroke risk. Hormone therapy has many different kind of medical reasons, and you do not want to stop taking it before consulting a doctor. As for vitamins and herbal medications, there's no specific definitive data to say whether they're effective in preventing stroke. And in fact, some herbal medications have actually been found to be harmful in some cases. And the reason for that is because herbal medications can oftentimes interact with prescription medications, either making them less effective or too effective and could cause potential harm. And for this reason, it's always good to discuss with your doctor or pharmacist when starting new medications or supplements to see if they could potentially interact with any medications that you're taking. Okay, now let's kind of step away from kind of medications and pills, and let's look at some of the other kind of lifestyle things that people can do to decrease their risk for stroke. One is through physical activity. Physical activity we know has multiple benefits to decreasing your stroke risk, along with weight control, cholesterol improvement, mood and memory benefits. Exercise also means different things to different people. And the idea of starting a new exercise routine is oftentimes very daunting for patients. The big thing that's really important that we really try to stress with all our patients is to find something that you know can work for you and stick with it. If that means walking 30 minutes a day, 5 to 7 days a week, then do that. We don't expect everybody to go out there and start running or riding bikes or doing, large strenuous activities, and really kind of stick with something that you can really manage and continue with it. The next things I do want to talk about is kind of how alcohol plays into potentially reducing your risk for stroke. Okay, so studies have found that there is a correlation between consuming alcohol in moderation and reducing an individual's risk for stroke. One question that always comes up though is what is moderation, or what does a glass of wine or a glass of beer fully entail? And for men, it's 2 drinks daily, and for women, it's 1 drink daily. And as for kind of fluid ounces, for beer, it's 8 ounces. For wine, it's about a 4-ounce glass of wine. And for hard liquor, it's about 1 ounce. For those individuals who do not drink daily, but still want the same benefits potentially from alcohol that has been proven through multiple studies, it has actually been shown that if you consume 1 drink in moderation a week, it provided the same exact benefit as consuming 1 drink daily. That, of course, is in contrast to someone if you drink either high or moderately high amounts of alcohol, because that leads to hypertension, diabetes, obesity, AFib, and liver damage. And as we know, hypertension, diabetes, and AFib are huge contributing factors for found a lot in our stroke patients. One thing that always comes up when discussing with patients is what kind of diet should I be on? What should I eat? And these days, there's so many different diets that are out there. There's the low-carb diet, the high-protein diet, the paleo diet, the vegetarian diet, and there's so many different options out there. There have been studies looking into that, and this particular slide that I'm showing is one of the studies that was out of the New England Medical Journal. And this one specifically looked at 2 different types of diets, looked at the Mediterranean diet, and also looked at a low-fat diet, which is something that is always encouraged with a lot of cardiac patients in general. And so one of the main differences is you have Mediterranean diet, which focuses kind of more on having olive oil, fruits, vegetables, nuts, and kind of substituting the white meat for red meat, as opposed to a low-fat diet has more kind of baked potatoes, bread potatoes, pasta rices, fruits, and that really tends to cut out oils. And so the study conducted over 5 years, and I'm going to kind of share with you guys the specific outcome of that study. So what the actual study found was that it showed that people who consume a Mediterranean diet actually had a reduced risk of stroke as compared to those who have a low-fat diet. We can see it pretty much through a lot of the data that the Mediterranean diet, if you break it down even further, which focused mainly on patients consuming more extra virgin olive oil than than nuts in their diet, that actually proved to have a larger benefit than a patient who just consumed kind of the nuts with the specific diet. So it's actually a really good thing to look at and know moving forward that there are specific dietary modifications that you can take and adapting this specific diet that will help to reduce your risk for having a stroke. Similar to when you eat diets, one of the main things as if you were to start something new, make sure you do it in moderation, you do it kind of in a step process. The idea of trying to do it all at once, oftentimes people will fail at their diet. So do small incremental kind of breaks as time goes through. And I just wanted to kind of conclude here, everybody remember that stroke is treatable, stroke is definitely preventable, and that time is essential, and that everybody can make a difference. So when if you notice anybody with signs and symptoms of stroke, remember the Be Fast mnemonic that Dr. Middle talked about.
So now we would like to close our seminar today. We appreciate the time that you gave us today, and we want to thank you. We want to thank everyone again for joining us today. We encourage you to learn more about Sutter Stroke Services, again, at sutterhealth.org/stroke. You can also reach out to your nearest primary stroke center hospital, the American Heart Association, the American Stroke Association for resources and information. Thank you.